Hey, welcome to episode 4 of the David and Brandon podcast, where we interview international workers from around the world of the Alliance. Today, we're thankful to have Jeff and Amy Lane with us, some of my favorite people who come from the best Alliance church in the whole country, share a home church, Centerville Community Church, and we are thankful to have them on today. If you guys want to introduce yourselves, maybe tell us a little bit your background, how you maybe even ended up serving where you're serving.
Sure. My name's Jeff Lane. It's my wife, Amy. We come from Southwest Ohio, and yes, from the best Alliance church in the country there, Centerville Community Church. That's our sending church, and we live and work at Bongolo Hospital in Gabon, which is Central Africa, right on the equator, Western Africa. You can't miss it. Small country. But we've been here about 3 years now, full time. And 1 year prior to that, we were in French language study. Prior to that, we were in the Dayton area in Centerville, Ohio. And we were just living the kind of Western suburban Christian life, enjoying a great church. I'm an anesthesiologist. It's my medical background. I worked at Miami Valley Hospital there in Dayton, Ohio. And God called us out of that season of life to become missionaries. Obviously, there's a lot of steps involved there, but there was a sense maybe about eight years ago now that God was calling us to something different. And took a couple short-term trips actually out here to Bongolo Hospital with some friends that I work with at that hospital I worked with, and just fell in love with the place. And on the second trip here, God really spoke to me and said, hey, this is where I want you to come and where I want you to work and where I want you to follow me. And it was really life-changing, obviously. After that trip, I had to head back home. And of course, my wife already sensed that something was changing and that may be a possibility that we may move away to mission life. So we prayed about it, and that's where God led us. And we've been out here, like I said, for 3 years now, full time. We have 2 children. They're grown. Our son, Aaron, and our daughter, Sarah. They live actually in the same area there in Southwest Ohio, and are doing well. Our daughter, Sarah, is married. Her husband, Adam. They have 2 grandchildren. And it's just been quite a ride since we've been out here in ministry. We've seen wonderful things that God's been doing, and just been a joy to serve him out here. Certainly there's been trials out here. But we serve a great God, and just love to be on his path. I don't know if you want to add anything, honey.
That's us.
Nice. Tell us a little bit about the hospital where you guys serve. The quick 2-minute. Hopefully, they froze. We were worried about internet. Obviously, we're coming from all over the world, but hopefully we'll jump back here in a second. But I don't know if they can hear us. It doesn't look like they can. See if they'll come back on here in a second. The challenges of life overseas.
We can cut this out.
Yeah.
Either that or just leave it rolling and people can watch. Oh, here they come.
Oh, now they're back.
There you go.
There we go.
How much did you get?
Yeah. I may leave that in the recording because this is the reality of life overseas.
Give people a touch of that African internet.
Yeah.
So I was saying, tell us a little bit about the hospital where you guys serve, the quick, 2-minute version or 1-minute version of the background.
The hospital, it was started as an Alliance work in the mid-'70s. There was actually a mission here, a CMA mission here that started back in the late 20s, 30s for church planting in the country of Gabon. Fast forward up to the mid 70s, they wanted to start a hospital on the Bungalow campus. And so they called out Dr. Dave Thompson and his wife and some other nurses to come out here and start the hospital. We're about a 160 bed hospital, full services, surgery, medicine, pediatrics, obstetrics, maternity, and a big eye center. So we run a full service hospital that sits out here in the jungle. We're actually, 8 to 10 hours from the capital city. It's very remote, but we serve probably 2 to 3 of the provinces here in southern Gabon with the healthcare that for all the people that are down here. It's rural, but we are pretty much the only center that is operating, at least, that can provide the healthcare here. Our kind of mission and our vision of the hospital is to not only provide good, compassionate care in Jesus' name, but also to share the gospel with every patient visitor that comes through here. So we have quite a busy chaplain program, and then even us healthcare providers, when we have opportunities, we share the gospel with everybody that comes through. So yeah, busy place, very remote, and a lot of history in the Alliance, and we're just privileged to be a part of the team that's working here.
Yeah, I was going to say, when you say history with the Alliance, my family started attending an Alliance church when I was in junior high. And before that, we had no experience. I don't think any of us knew what the Christian and Missionary Alliance was. But I have very clear memories of being a junior high and then high school student and hearing stories of Bungalow Hospital. Mm-hmm. That was often some of the talk. And so that was, 20 plus years ago. So I also know that one of the dynamics of the work, and I would love to hear an update on this, is, like you said, started by American missionaries, but now what percentage of the staff are local medical professionals? Obviously, you guys are still there and part of the team, but what's that dynamic been like, and also that transition? Because I know that's been part of the plan, right?
Yeah, that's definitely part of the plan. Right now, we have 110, 120 Gabonese people that work at the hospital in comparison to 15 to 20 expat missionaries.
Okay.
So, I mean, that's kind of the ratio of, and the national
about 1 to 10, right? Is that right?
Yeah. And the national church, the Alliance Church that was born out of the ministry, by the Christian Missionary Alliance US, the national church here, the Alliance Church, actually runs the hospital. They're the administrators. They run the administrative component of the hospital. It's a function. It's a ministry of the national church.
Right.
We look at ourselves as coming alongside, and obviously we work and do medical stuff and take care of patients. But a big component is training. Mm-hmm. Training others, whether they're Gabonese or other Africans that come for our training programs, to just be skilled, training them in good healthcare practices, but then also discipling them to be good Christian leaders wherever they may go. If they stay at the hospital and work for us, if they move beyond us into Gabon, or if they go throughout the African continent to work. So that's another main focus of our ministry is training. We have training programs in anesthesia, my training program. We have training programs in surgery, ophthalmology, nursing, and also nurse midwife training. So yeah, it's a big component of our ministry here, definitely.
Jeff, you had mentioned, I've heard you say this at church, but in Africa, just the lack of proper anesthesia has just caused just death and all kinds of major problems. And so with you tackling that, give us maybe some of the statistics of that especially when you first went, and really what was the the huge need that you were going there to fill. Tell us about
Yeah, there's a remarkable need, and the best way to kind of describe it is global surgery, or this an overall surgical need. Anesthesia surgeons and obstetricians are kind of all lumped into this whole need for not only the people of Africa, definitely people of Africa, but elsewhere in the world as well. But like on the continent right now, there's probably 58 to 60 million people that need surgery that can't get it. So it's multiples of problems. Number one is either access. They can't get to a facility that can provide them with good surgical care. When I say surgical care, it's either surgery or from the obstetric point of view, or having babies, it's being able to take care of somebody that needs surgery to have a baby, a cesarean section. So these people can't get to the hospital, number one. When they get to a hospital, the people there may not be qualified to do it. They may just know might not be somebody there that could even do the procedure, or they don't have the right equipment to take care of the problem. So it's a big problem throughout Africa, sub-Saharan Africa for sure. One of our goals is to train and disciple Africans to stay in Africa, to help with that burden, to help on that education component, to have people that can actually do the procedures and are well skilled to do those. From an anesthesia standpoint, there's statistics in Africa, not necessarily in Gabon, but in other areas of Africa. I don't know what they are here in Gabon, but where 1 out of 200 to 300 anesthesia cases, that's the death rate. So one person would die specifically related to an anesthesia complication. 1 out of every 200 or 300. Now, in comparison, in the US or Western world, Europe, Australia, that's more along the lines of 1 to 250 to 300,000 cases, where there's a problem specifically related to anesthesia, where a patient may die. So it's a huge need to train people to do anesthesia correctly. So that's kind of the shock factor, those numbers that, are like, whoa, and it's real. It's a real thing throughout Africa. So, yeah.
Wow. Obviously, in the world now, we're facing some COVID-19. It's on everyone's minds, what everybody's talking about. We're all kind of on lockdown. Here in the Dominican, I know in Washington, D.C. as well, we're all stuck in our homes. So what are the restrictions? Are you under any restrictions where you guys are at? How are you guys personally handling it?
Go for that.
Oh, well, I can tell you about the restrictions. The restrictions actually came around here pretty quick. Before we even had
any cases. They shut the borders, they shut the airport.
They came out at first, we couldn't meet in any groups bigger than 50, and then now it's down to 10, so you can't meet in a group bigger than 10. No funerals, no weddings, no church gatherings, across the board, not just for Christians, but for Muslims and Catholic parishes. Everything is closed. And then technically you're supposed to wear a mask whenever you're out in public. For us down here, they haven't done anything much beyond that. Up in the capital city, now that there have been more cases, that city's basically on lockdown. You have to have permission to go out of your house. You need to stay within a kilometer of your house when you go out to get food or whatever. What else?
Yeah, it's
basically there's just a lot of police checks, and it's basically they've really tried to lock the city down. They're trying to keep people from leaving, mainly because almost all our cases are in the capital city right now. So I think they're just trying to kind of contain if they can.
Yeah.
How's that been received by people? Are they compliant? Are they understanding and like, oh, we get this. This is what we're going to do, or is it, yeah, kind of resisted? How's the community response been?
I would say down here where we are, it's been mixed. I mean, some of the people that work at the hospital, they get it. They understand it. You know, they're in healthcare. They kind of understand that we need to be washing hands, wearing masks, staying separate. So there's that kind of smaller component. We have a small town nearby, and probably our local area is maybe 5,000 people. Most people are not even really abiding by a lot of this stuff. And that's, you know, I think a lot of that has to do with the culture here. You know, there's a lot of just kind of surviving for the day sort of attitude. This isn't necessarily something that, you know, okay, they may know about the virus. Okay, well, okay, but there's malaria here that could kill us. There's all this other stuff that could kill us. I'm more worried about going out and getting food for my family today than trying to abide by all this other stuff. Yeah. There's a curfew. Yeah, and most people are abiding by that because the police are out and they're enforcing it. But
and our churches aren't meeting. I mean, the people are following the rule for gatherings, and that's also been a little bit monitored by the police and enforced a little. So people are pretty respectful of that here.
Yeah. Mm-hmm. But on the whole, yeah, I mean, people are just trying to live their daily kind of survival life, you know, get out so they won't. That may change if the virus comes down country to where we are, you know, then they might see people getting sick and that. But for now, it's kind of a relaxed. You don't see it. I mean,
yeah, nobody's wearing a mask.
Yeah, they should be, but yeah,
we are.
Yeah.
Well, I'm curious to maybe now focus in a little bit on your perspectives as well as the hospitals. Brandon and I talked about, you know, what other workers that we could interview and hear from, and we both thought how cool it would be if we could talk to some of our medical workers. You know, a lot of us are not working in medical work, and so our experience through this whole pandemic, this global experience of shutdown, and as you're experiencing church services closing. So a lot of the nature of the things that we're doing, we're staying at home and trying to find ways to adapt to online presence or just Zoom meetings with people. But you guys are in a very unique position. You obviously will still have patients to care for. I mean, there still will be hospital work, right? Ongoing. And yet there's this new thing coming. So I'm curious, from your perspectives, from the hospital perspective, you said you don't really have cases yet. I think I read on the Bongalo webpage that you had a suspected case recently. I did a little homework before talking with you guys. I realized that's something that I can do. So what kind of plans do you have? How are you getting ready for it? Are you beginning to, you know, here in the States, there's been a lot of conversation about the protective equipment, making sure workers have enough of that. Is that a concern? Share some of that perspective with us, because again, there's so few of us working in Alliance Missions that are in the place that you are, that personally I find it very interesting and would love to hear from you on.
Yeah, it's interesting. You know, I think personally, from a healthcare worker standpoint, you know, my life hasn't changed that dramatically as far as getting up, going to work. You know, I leave my house, I go down to work, and we still need to take care of people. There's other diseases, other things that are happening here in this part of the country. People are still having babies. People are still getting in car accidents. You know, we still need to do that work. So day-to-day life like that is still the same. But it's been an interesting time. It's been a time of kind of, we're in this wait and see what's going to happen. We're in this kind of, man, we see what's going on elsewhere. Is that going to come here? You know, and the blessing's been that God has allowed us to prepare, and hopefully we prepare well. We'll see, you know, if and when things come, we're going to prepare the best that we can. But we've had this time to prepare, and for example, we've been able to convert an older unit, okay, into our COVID isolation unit.
Okay.
It's empty right now.
Thankfully.
I hope it's empty forever.
Yeah.
But it was a blessing that our eye clinic moved from an old building to a brand new building 2 months before this happened. So we have an existing structure that has rooms and beds, and we had to do some, you know, modifications to, you know, get ready for things. But we have a fully functional unit that, if patients come, we can go, we can send them down there. So that's been a blessing. We've had time to prepare the staff, and we are still doing that. It's ongoing, but prepare the staff on how to take care of COVID patients, on how to put PPE on, take that off, on thinking through right protocols. We've actually run 3 different simulations. We had the one that we thought was real, and we messed up, you know, taking care of that patient a little bit. But then we thought, okay, well, let's add in some other simulated patients. Somebody, you know, actors, one of our missionary colleagues, you know, hey, you know, I'm not feeling well, I'm coughing, I got a
We have
fever.
a checkpoint.
There's, the hospital is basically closed now as best we can, and has a checkpoint for people to come in, measure their temperature. So, you know, God's afforded us some time to actually get ready and prepare protocols, which has been good on the one hand. On the other hand, you know, in late March, we ramp up all the country restrictions. We're ramping up all this communication. You know, you feel like the end of the world's coming. And then now these last 2-3 weeks, we're just kind of like, okay, is it coming? You know, you're in this fog of, okay, is it coming or not? You know? Yeah, so, I mean, that's where we're at as a hospital. We're prepared as best we can. Equipment wise, I think we could use more PPE. The government has some PPE that they've donated to us. We've had some that was previously donated for Ebola, if that ever took off here, back when there was a lot of Ebola way up in West Africa. But so we have enough to start out. Hopefully we can get some more of that. So we've been in contact with the government system, the official system, to test and treat. So if a case comes, we have avenues to talk with the government. And so, I mean, that's where we're at as healthcare professionals. Yeah.
I mean, the big seems like the hot ticket item has been respirators.
Right.
You guys have those? Is that just like, they just don't have access? Like, tell us about that.
Well, we actually have one ventilator, and we use it sparingly. We use it from time to time on patients that we think that we won't need it for 1 day or so, a day and a half. Then we'll use it. The main issue that we have here, it's great to have a ventilator, or even if you had 5 ventilators, we just don't have skilled staff to run an intensive care unit. The ventilator is a nice tool, but for instance, with COVID, it's one tool, it's a necessary tool for those patients that are very sick. But there's a whole armamentarium of medicines and dialysis machine, you know, all this other stuff that you need to have to take care of the sickest of the sickest. And we can't do that here at all. We just don't have the manpower or all that other technology. You know, that's where we're at with that. The hopes are that if somebody did get that sick, we could send them to the capital city where they can do that kind of work up there. Now they're limited up there as well. across Africa, we still talk about ventilators, but it's probably more about just ICU care throughout Africa. It's not, the healthcare capacity is just not there. In many countries, it's very, very diminished. In some countries, it's better than others. So I like, early on, and they still talk about flattening the curve. They have the curve if you don't do the mitigation measures, and then if you do them, you kind of flatten out the curve to get below that healthcare capacity. If you don't have any capacity, I mean, it kind of really doesn't make sense. I mean, you can flatten it out as much as you can, but you're still going to have a lot of trouble taking care of people with limited capacity.
So
and we fall into that here at Bongolo as well.
Is there a concern for a large impact, in Gabon and then throughout Africa? I mean, with the medical workers that and interact with at Bongolo, but within the medical field, I think I understand, we've seen here in the States, this curve and the line of the healthcare capacity. You're saying, well, maybe that margin is so very, very thin in Africa. What is the concern for a, big impact of this?
Yeah, I mean, the concern would be that you can't take care of the sickest of the sick, and they would pass away, quite frankly, because there's no care. Now, and the biggest concern would be not necessarily here in Gabon, because we're not a real populous. There's concerns here, obviously. We're not hugely populous here, maybe 2 million, a little less than 2 million in the whole country, but like Congo and other countries that have massive amounts of people in big urban centers that live close together. There's zero chance to social distance. There's very little healthcare capacity. If it would run wild in some place like that, then it would be devastating. Even if the percentages are low, the sickest of sick and those that are dying are low, it's still a large number of people in those centers.
Yeah. What's the capacity for, I've thought about this when I think about friends in other parts of the world, just to practice good hygiene, for us, wash your hands. That seems like a very helpful step. And yet in some places of the world, it's just not that easy. Can you share anything on that? How to instruct people where you are? Is that, hand washing, is that a challenge?
Yeah, I would say it is. It's just not a big part of the culture here anyway. So to try to instruct that, it's a challenge. Just all of those measures are a challenge in this type of a culture, which they're all about hugs and being close and multiple people in a room and just a very social,
families living all together.
Family oriented. It's difficult to even think about social distancing. It's just, it's not a way of life. It's very difficult for people to even approach that.
There's some hand washing stations in town, like in front of the stores and at the market. Today we saw one, and we've got them around the hospital now. But you have to remember, part of the instruction was that when you wash your hands, you have to use soap. It's not just like a little rinse off water or the river or in the wherever, it's, so some of it, it's just, you don't even think of how basic we need to be.
Yeah.
Sure. Let me get a bit about maybe the spiritual impact of this, the emotional health piece of this. There's obviously the stress, everyone's freaking out about it. Are you seeing opportunities, spiritual opportunities through this? Are you seeing any sort of any negative emotional, mental health kind of impact from this at all? Obviously you guys are more remote, so it hasn't quite hit their full force yet, but are you anticipating that or seeing that at all?
one of the things that we were just talking about earlier even is just like for our church, the community that people receive or get when they're at church, there's no streaming, there's no following online. Like our pastor's not doing any service online. He brings around every couple of weeks a piece of paper that's got like a little chart on it, and he wants to know like how many people are at your house. They're just encouraging like small group church, and who preached, and what did they preach on, and how many boys, how many girls, what was the offering, like that kind of thing. That's all they can do, really. And I just know like how important that community is.
Yeah.
To the people in the church. So, and we're spread out. Like I don't know.
Yeah, church is life. I mean, that's community. It's where you go and get your news. It's where you meet everybody. It's every Sunday and then all throughout the week. It's just a way of life around here that's been taken away, and you can kind of see it on their faces that it's pretty draining. Like they miss that community aspect of it. They being our African colleagues and people that we work with. From a mission team standpoint, the missionaries that are here on the station, most of us went to different churches, and I would say, uniformly, we miss it as well. Obviously, not getting out, kind of like you all probably, you miss community. You can watch online sermons and you can do this, but you miss the community aspect and getting out. So it's been emotionally tough, for people. I think, and then just emotions on our team have been all over the board. We've but we've, chosen to meet like this. Our team's bigger than 10, so we can't all get together in a room. But so we meet like this, even though we all live on the same compound, we meet like this twice a week, just to basically say, how are things going? And just process things and, what are ups and downs, and just see how people are doing. And most people see each other at the hospital, but you're working. So it's been a good time to decompress and just because the emotions are kind of all over, The biggest emotion here is that you kind of, even though we're isolated, even though we've been isolated since we've been here. I mean, we're in a remote place. We go to the grocery store, and even before COVID, there may not be things there, and you might have to wait till the next time, We read about that in the Western news. It's like, oh my gosh, I went to the grocery store and there's nothing that, like, well, that's like routine. But I think one of the biggest things right now is that the borders are closed, and we're here. We've chosen to stay here. We're committed to this work, but we're trapped. I mean, we're blocked. We can't get out.
Yeah.
That's some of our teammates are really trying to process that. Like, it's tough.
Yeah.
Because in the past, to be like, okay, if I got really sick with COVID, maybe I could get out, get to France, get home. If a loved one back in the States passed away, or I needed to get home real quick. But we all realize that is just, you can't, we're here. We're stuck. You can't, there's nothing, no one's coming or going. So that's been a big kind of emotional thing for the team, I think, just to kind of process. What do you say?
Yeah.
No, I get that. We're basically stuck here as well. But one of the cool things in that is we've had some of our Dominican friends just say, "Oh, you're still here," because there was a window at the very beginning to get out.
Yeah.
Right now we're staying put. So that's been I think in some way a positive thing, but there is an emotional toll to it. Like
Yeah. Another big emotional thing for the team is just healthcare. I mean, we work at a hospital. We're physicians and nurses that have been trained in the, we're skilled at it, but we don't have the resources to take care of the sickest of sickest, like I mentioned, if they get really bad COVID. Well, that doesn't include just our patients. If one of us gets sick really bad, trying to process through, wow, that teammate could get really sick and, may not make it to where they could get a ventilator or really good care. And that's been a thing that we're all processing and trying to work through. Tough questions, tough things to process with each other, but we're committed to stay here and work as a team. So,
and we did have people too at the beginning. Well, like Pastor Serge, he's our administrator. I mean, he was asking like, "Well, are you guys leaving? Is everybody going to leave?" And we said, "Well, no, we're staying." And he was, grateful for sure, but he's so appreciative. He knows, he's been to the U.S. He knows kind of the sacrifices that people make when they come over here, and he was really touched that people were staying, like you said, encouraged that we're not going anywhere. So.
Yeah.
I'm going to kind of put you on the spot, but I feel motivated to ask this question, and I'm sure you have a good answer. So don't be afraid. No, my question is, for many, everyone can see the reasons why you would go back, the reasons why not to stay and put yourself at that type of risk or potential for risk. Yet we know, like a theology of risk, there's risk everywhere. And, a lot of our workers boldly go into these types of places. But my question is, why do you do this? Because I think there's something, I'm sure there will be a beautiful answer that can be encouraging to anyone who hears it. But, why, why do you, in the face of that type of very clearly potential risk, say, this is what we're going to do. This is what we're committed to. Yeah. Can you share a little about that?
Well, I was reflecting on this, and I'm sure a lot of our team has reflected on this too. Number one is that I think we've all prayed about it early on because we had an opportunity, and none of us really got a clear, like, you need to get out of here. You were called here to work and to follow Christ here and work here. No one really, everyone. We processed it early on. Like, does anyone feel like they need to leave? And uniformly, it was like, no, we feel very dedicated to stay here. And maybe for me, maybe the risk hasn't really changed that much. Okay, there was a big risk just to come over here and to work and to be in an environment where, we could catch a myriad of other viruses. We've had people evacuated from here that have had other deadly, quite frankly, viruses. So, yeah, we know there's one that's coming, and we are educated enough to know, and we're seeing how it's working, but there's risk, but I can't remember, there was an author who wrote, risk is right. God wants us to be out in the risk part. That's where he functions. That's where he works. We're expecting to see great things come out of that risk. Not being foolhardy, not like going into a, gunfight with, a small knife sort of thing. But, knowing that we're smart, we have a system, we can be protected. We're putting in, our own little mitigation efforts here on the campus. We're trying to do our best. Most of us are middle-aged or younger, so that risk, the population that we get. So, I think that putting that all together, our mission and vision is still to take care of the people here with compassionate care and train people and show them the love of Christ, even in the midst of some unknown crazy virus that could show up. Yeah.
That's awesome.
It's somewhat like an eternal perspective too. Like life in the U.S., we've gotten so used to comfort and everything's so easy that we forget our own mortality. And it's just a good reminder, that this life 100 years ago, even in the U.S. and then across the whole world, was just risky. And so people leaned on faith, knowing that there's an eternal hope. And so maybe the last 50 to 75 years in the U.S., it's been very easy, but that's not normal. So to have that eternal perspective, I think is super important. Appreciate you guys having it for sure.
We are probably 5 minutes from having a large rainstorm
On a tin roof.
on a tin roof.
So-
But that's authentic. We are in the middle of the rainforest, so maybe not, but it's, yeah, I can hear it coming. Just-
We will keep you.
Ahead
let you
longer.
know. That's great. Love it. Yeah.
Amy, did you have an answer to the why for you personally that you wanted to share?
Oh, yeah. I don't know. For me, like, as I was praying about it and thinking about it, we have family in the U.S. I miss my family in the U.S., but I really feel like we have a family here. The people that we work with, people we serve with, the people that we work with at the hospital. And I've just never have felt like, what are we doing here? We need to get out of here. I mean, I don't.
Yeah.
That's not a very profound answer, but I just feel a lot of peace when I pray about it. I feel like we're where we need to be right now. And I would be sad, actually, if we had to leave. Like, if they came and said, you have to go, it would be really hard to leave. Like, I feel like we would be leaving, like, our family in crisis, leaving our, like all the other workers at the hospital. That's kind of how
Yeah.
I don't know.
Mhm.
Not that they're all waiting too. Everybody's just waiting, but
No, I
it would
think
be-
that those are amazing answers, really. I think what's so normal for you guys, and even for others of us who have chosen to work in other countries and made those choices. I mean, I don't know what it's like to live in Africa. But as Brandon said, we've moved to the Dominican Republic and lived in Mexico and been committed to that. And you do create, for everything you give up, every family you say goodbye to, you say hello to a new place. And, why do we do this? It's because the reason that the motivations that moved you there, like that's why you stay there. And there is such potential to continue. There's ongoing work, even in the face of new challenges, new situations. So it may not turn into some quote that people write on the wall, but it's very profound what you're saying. And it's true. And I think it is an encouragement for people. We're not sure how many people are actually watching these things. A number of people are, and we're not sure who they are. But I'm sure for some, just your consistent faithfulness and commitment to the work that God's called you to, that you've been committed to the last number of years and will be continually committed to going forward. I'm sure there are people that will be encouraged just by your example that you're setting, and the lives that you've chosen to pursue, and the ways that you've been committed to serving people and communities and around the world. So thank you for sharing that.
So I think before we close, is there any last thing maybe that you'd want to share, or word of encouragement to people back in the U.S.?
And before the rain comes.
Before the rain. Yeah.
I don't know if it's coming or not.
That's awful.
We see what's going on in the U.S. and I think, a note of encouragement would be just that we're praying for, you guys in the U.S. family, the Alliance family in the U.S. Life is very different there than it was, even just a few months ago. We're praying for protection. Even as they start to open things up, we hear that God would continue to protect and keep the virus away from folks there. And just know that there's people around the world that are even praying for the U.S., people in the U.S. that, I don't know if you have anything else. Yeah.
Well, thanks for carving out some time with us today. We really appreciate it. I know you guys have very busy schedules at the hospital, and it's an encouragement to me, and I know David as well, to spend a few minutes with you. And one last little shout out to Centerville Community, Kedrick, and the whole team.
Centerville Community Church, Pastor Kedrick. Yes.
All right, we'll see you back in with you.
A lot of fun, guys. Thanks.
Yeah, no, thanks for joining us. This is great.
Yeah. God bless. Stay safe, healthy.
All right.
Wash your hands.